Let's talk about the 5 early signs that you may be deficient in vitamin D. Hi there. Hi there. Welcome back. I'm a functional medicine provider. I'm a specialist in finding the root causes of your health problems so you can live a better life. Today we're going to talk about the 5 early signs of vitamin D deficiency. I have an awesome quiz for you at the end, so make sure to stick around till the end to see if you might have a vitamin D deficiency. The problem is that vitamin D deficiency is associated with so many chronic diseases, from diabetes to autoimmune disorders, to cancer, to heart disease, to Alzheimer's. It's just all over the place. But what are the early signs? Because maybe you're not sick yet. Maybe you just don't feel 100%. Well, let's find out the 5 early signs. No. 1. Bone and back pain. This is really common. Now, vitamin D helps your body absorb calcium, and without enough vitamin D, your bones can become weak and sore, and you can even develop a condition called osteomalacia or osteopenia, where your bones are at risk for fractures. So I have a question for you. Have you ever noticed bone or back pain without any apparent injury? So it could be a sign of vitamin D deficiency. Now the problem is, a lot of people just kind of ignore these aches and pains thinking, oh, it's just wear and tear. Or they'll just pop a pain medication or take some ibuprofen and just push through it. The problem is the underlying cause is never being addressed. And in my practice, when I see patients, I try to figure out the root cause of their problem, because treating symptoms is not the same thing as treating the cause. In fact, suppressing symptoms can actually make the actual problem worse. So instead of masking the symptom with medication, it's best to identify and correct the underlying nutrient deficiency. In this case, taking vitamin D not only helps alleviate bone and back pain, but also promotes overall bone health, reducing the risk of osteoporosis and fractures later in life. No. 2. Frequent infections. Another sign of vitamin D deficiency is frequent respiratory infections like bronchitis and pneumonia, urinary tract infections, or UTIs, or even skin infections. So why does this happen? Well, vitamin D plays a crucial role in supporting a healthy immune system, helps regulate immune responses, and protects against harmful pathogens. A study published in the Journal of Clinical Endocrinology and Metabolism found that people with lower levels of vitamin D were more susceptible to getting respiratory tract infections than those with sufficient vitamin D levels. Also, vitamin D has been shown to reduce inflammation throughout the body, including in the sinuses. People who are deficient in vitamin D are at increased risk of developing sinusitis, which could lead to recurrent sinus infections. Number 3. Hair loss. Now here's an interesting one. Do you know that vitamin D receptors are present in hair follicles? Hair follicle cells contain vitamin D receptors, and studies have suggested that vitamin D is necessary for maintaining the growth and health of these cells. A study published in the Journal of Investigative Dermatology found that vitamin D supplementation promoted hair growth in people with alopecia areata, an autoimmune hair loss condition. And other studies have shown that vitamin D may play a role in preventing and treating androgenic alopecia, the most common type of hair loss. So if you've noticed excessive hair loss or thinning, it might be time to check your vitamin D levels. No, for depression and mood disorders. So how does vitamin D affect your mood? Well, believe it or not, there's a connection between your brain health and your vitamin D levels. Your body produces most of the vitamin D when your skin is exposed to sunlight. This exposure to sunlight also boosts serotonin production, which is a neurotransmitter that regulates mood, sleep, and appetite. So low vitamin D levels have been linked to mood disorders like depression and seasonal affective disorder, SAD. And the good news is that increasing vitamin D levels through supplementation or sun exposure has been shown to improve mood and reduce symptoms of depression in some cases. So if you've been feeling down lately, might be worth checking your vitamin D levels and trying a supplement to see if it makes a difference. No. 5. Muscle weakness. This is a big one. You may have noticed that your muscles are weaker than normal, or you might notice that it's harder to get up from a seated position or climb a flight of stairs. You might even experience muscle pain or cramps. All of these could be signs of low vitamin D levels. You see, vitamin D helps the body absorb calcium, which is a mineral that's essential for muscle function. When you're deficient in vitamin D, your muscles don't get the calcium they need, which can lead to cramping and spasms and weakness. Plus, vitamin D also plays a role in regulating muscle proteins and enzymes that are involved in muscle contraction. So if you're noticing any muscle-related issues, it's worth checking your vitamin D levels. And if they're low, supplementing with vitamin D might help strengthen your muscles and improve your overall physical performance. So now that you know the 5 early signs of a vitamin D deficiency, it's time to check your levels, right? Well, here's a quick quiz to help you find out if you might have a deficiency. Are you between the ages of 1 and 70? Are you fairly active outdoors? Do you consume fatty fish or foods high in vitamin D on a regular basis? Do you use sunscreen when you go outside? If you answered yes to the first question, no to the second, no to the third, and yes to the fourth, then you are at a higher risk of being deficient in vitamin D. And if you answered yes to the first question, yes to the second, no to the third, and yes to the fourth, then you are at a medium risk of being deficient in vitamin D. And if you answered yes to the first question, yes to the second, yes to the third, and no to the fourth, then you are at a low risk of being deficient in vitamin D. However, if you are concerned about your vitamin D levels, it is always best to get them checked by taking a blood test. There are 2 main types of vitamin D blood tests: those that measure the levels of vitamin D in your blood, and those that measure the levels of a chemical produced by your body after it has converted vitamin D into its active form. In a word of caution, the results of these blood tests should be interpreted with care because factors like age, race, and kidney function can influence the levels of vitamin D in your blood. So rather than relying solely on a blood test, it's important to consider all of your symptoms and medical history and consult with your healthcare provider to determine whether or not you actually have a vitamin D deficiency and to discuss the best course of action. Now, if you want to learn about the best natural sources of vitamin D, watch this next video. Your health matters. Start with one habit today. And if you enjoyed this video, don't forget to like, comment below, and subscribe to stay on this journey with us.